I'm Randy Alvarez. You're watching the Randy Alvarez podcast. We're talking about what you need to know if you're considering dental implants. And this is kind of a behind the scenes look. You know, when people come on my show, we oftentimes talk just about the good stuff, the eating and the chewing and the self-esteem and all of those other things, but come to find out that sometimes implants, it doesn't work out. They fail. Maybe they get loose, they fall out, things break. Materials matter and the experience matters. So on the show today, we have Dr. Clow, who is an instructor and teaches dentists across the country on how to do these procedures correctly. Dr. Clow, welcome to the program. Welcome back, I should say.
Thank you for having me.
All right, so I have a list of stuff I want to talk about. Let's start with, and I want you to talk about this. What are your thoughts when you see these advertisements? Here you flew out here to California. In LA, we have billboards that say $195 an implant, down from $295. Or they're advertising like what you guys use as temporary teeth. They're advertising as like a full arch of teeth that don't come out. And so they've got these like low prices, $99.95 or $12.95. So tell me about what you think about what's going on out there.
Well, I mean, that's a sensitive subject, right? Because we have a lot of friends in the industry that do that. So I don't want to hurt anybody's feelings or call anybody out, but I would say that, marketing prices like that can be misleading at times, or, maybe offices think that maybe it's deceitful, or it could be. So I'd say to somebody that's looking at that stuff or seeing those ads is really be careful what you're getting. And
so the $195 for an implant, is that like just a little tiny implant they're quoting?
Exactly.
So it's misleading.
It's misleading. It's a marketing scheme, I think, to, if people are shopping around and chasing the dollar, they're looking for, the cheapest option. You got to be careful what you're asking for.
But we know who those guys are. They're charging a lot more. And so if they're misleading about one thing,
exactly.
What else are they misleading about? And I know you want to be polite.
So they're giving you the bare bones bottom dollar of what it might take to do this if you need nothing else. Say you need no extractions. Some patients need extractions, price goes up. You need abutments on top of those little screws, price goes up. Oh, you actually want teeth on top of those abutments and those little screws, price just doubled. And then what type of material are those teeth? And you got to be careful, as some people are saying, yeah, come in, we're going to do this for $12,000 or $15,000. You're going to get 4 implants, 4 abutments, and your zirconia teeth screwed in, and they're going to do it in a day or do it in a week. You get your final teeth in a week. And really, you got to ask yourself, what are you getting? Is what you desire is 4 screws and a set of teeth from a puck that they ground down? Is that what you're after? Why are you paying this money to get that?
Okay.
No, what you desire is a new set of teeth and a new smile and that part of life that you've been missing and your ability to eat. So what are you buying? You're buying a discount? Are you buying somebody that's warranting all 4 of those implants? Are you buying somebody that's doing the bare minimum? They're going to give you teeth in a day, or they're going to give you teeth in a week and never see you again? Who's going to take care of you afterwards?
Okay.
What happens if the teeth need to be adjusted? What if they break? What if they didn't give you the nicest material? So
in the long run, could that even cost more?
It could cost more. What if you have to come and see me because you paid the bottom dollar for 4 implants and a hockey puck set of teeth that you never got to see the doctor again, and then everything isn't working?
Does that happen?
It happens all the time.
Because they look for guys like you, because you teach this, right?
I teach this.
What is it you teach dentists across the country?
Some of the main things that I teach advanced surgery techniques for more complex cases. And then a passion that I like to talk to people about is medical history and medical risk factors for this surgery and what the patients can do to help these things last longer with less complications.
Okay.
So if you're paying the bottom dollar to go somewhere, you might expect to pay that again or more when you have to redo it or fix the problems.
Yeah, like I said, when they come on my show, I only hear about the good parts, but a lot could go wrong. Is that correct?
A lot can go wrong. And that's why it's really important to find out what you're buying and get a little information about the doctor that's doing it. Is it 3 doctors involved in it? Do you have to go to multiple offices? Do you have to have healing time and wait and grafting time that they didn't tell you needed and they're going to bill you more later,
and that's
implants later?
happening.
That happens all the time.
So when I see some of these low prices on Google, it's usually that kind of a setup.
It's usually that, and it's misleading, and it doesn't include everything that goes into it.
Okay. Questions about, again, we're framing this in our podcast about what you should look for in somebody that's going to do this procedure. Mm-hmm. How important is looking for a doctor that has invested and is all in with technology? And what does that mean to the patient?
Well, I think if I can, I'll expand on that question a little bit. I think finding the provider that does this every day and does this all the time and has invested the training into this specific technique and procedure and invested the money into the technology, I think that's the type of office and provider you're looking for. We have a lot of surgeons, specialists, prosthodontists, periodontists that do this, and they'll do just the implants. And then you have to go to the dentist that restores it, or the prosthodontist that restores it.
That puts the teeth on top.
That puts the teeth on top, exactly. Okay. And so now you're bouncing around offices, going to different providers. And most of these surgeons, their specific training is in surgery, and they're very good at it. And they're even in implants. But their specific training is not heavily focused on full mouth implants. And so there's a big difference between full mouth implants and oral surgeons that do that. And then most oral surgeons, not all of them, most of them, I mean, I have the utmost respect for these big dogs.
Okay.
Most of them don't have experience in teeth or restoring the teeth. They focused on surgery for all these years. Have they touched any teeth or restoratives or prosthetics? So you have to really find a provider that's got experience in surgery and experience in the restorative side. Now, if you go to a dentist, let me finish this chain of thought real quick. If you go to a dentist, this dentist, if this general dentist is interested in doing these procedures, that dentist needs to have experience with surgery. He needs to be able to do as good of a job as that surgeon. And now he has to have specific experience in surgery in full arch and full mouth implants. In addition, that dentist needs to have specific experience in prosthetics and restorative and a bite and occlusion, similar to the experience or the ability of a prosthodontist. So now you have to have a super general dentist that can do really good surgery and really good prosthetics. And same with the periodontist and the prosthodontist, those specialists. Really, the doc that you're looking for, the provider, the office you're looking for, needs to have somebody that's very experienced in surgery, very experienced in the prosthetic side of things.
Prosthetic is the making of the teeth or making the teeth fit on top of the implants properly.
The prosthetic is the teeth.
The teeth, okay.
The teeth. And so you need somebody with experience in both of those and a lot of that experience. So a surgeon that is experienced in it, but all day for his regular job, he places single implants, cancer, wisdom teeth, and that guy doesn't do all on 4, all on X, or full mouth implants every day. How good is he at it? And that dentist that does fillings, crowns, bridges, dentures, how good is he at doing the surgery of the all on 4, all on X, full mouth implants? And then how good is he at the prosthetic side of things? And the periodontist and the prosthodontist that are specializing in gum, bone graft, tissue graft, occlusion, prosthetics, those guys, are they doing all this other stuff? Are they seeing stuff from general dentists or surgeons placing an implant, and that periodontist is building this beautiful tooth and training the anterior gingiva to have this beautiful smile? If he's doing that every day, is he an expert in full mouth implants? You want to find a provider and an office
that does both,
that does it every day, and they focus on all on 4, all on X, full mouth implants.
So, and for a working definition, so I've come to understand, so all on 4 means a full set of teeth on 4 implants, and this all on X, maybe 6 or 8 implants, a full arch of teeth on top of that. That's what we're talking about.
Yep.
Okay.
I think some of those are trademark terms, but people know what they mean.
Okay.
The full mouth set of implants, 4 to 6, 4 to 8 implants, and then teeth that are anchored on top of those.
Okay.
And that's all. You want to find a provider that focuses on that and an office that focuses on that. And then you're moving down the right direction of finding the correct provider to do it. And so then the question I have for you after that, or the comment I would say, if I keep going, sorry, I ramble on when we get on this stuff, would be is that provider who focuses on this, who's moving in the right direction of doing nothing but full mouth implants and prosthetics and giving fixed teeth for that patient, maybe even the same day, is that provider experienced enough to handle the complications when or if they come about? And so those are the kind of questions.
You teach a course on this?
I do.
You lecture on how to manage?
I lecture on how to manage these complications and how to take care of them. And that's why I'm so passionate about med history, medical risk factors, and how to manage these complications and what can arise. And sometimes the complications are far enough out of the way that you have to call in for help. But really the provider that you want doing this is somebody that can manage the majority of the complications, take care of it, keep the patient happy.
How does the patient know?
The patient does know, yeah.
How many have you done? Like how often do you do it? How many have you done? 200, 500?
So I think
You've
those
done
are
thousands?
Yeah, those are valid questions. And if a patient asks me how many have I done, I guess. I've done thousands of these. I'm happy to help. How do I know if you can fix complications? These are great questions that patients don't ask. What happens if something goes wrong?
Typically they send it out to somebody else to fix it?
Right.
Okay,
right.
but you don't. You don't have to.
We try to fix everything in-house. Now, I can't fix everything, but I try to fix everything in-house. The team with Full Arch Masters is very, very good. And I think that's important for people to find a good team that helps take care of everybody. The complications that come up should be able to be managed by the person that does the prosthetics, if it's a prosthetic failure or issue, or the tooth issue. The surgery complications that come up should be able to be managed by that doc that did the surgery, if it's possible to be managed that way in a local setting. So these kind of complications like the bites off, prosthetic breaks, or the bites off and the pressure's not balanced, it can hurt some of the bones, stuff like that. Or the prosthetic, the tooth, the tooth bridge that goes on top of the implants isn't passive, it doesn't fit very nice and snug and intimately. Then if it's off on one side and screwed in, then the prosthetic can break. And so those are prosthetic issues.
So the teeth break because it's not balanced correctly?
Because there's a potential misbalance. It's not aligned, the bite's off. There's other stuff that goes into it. There's stuff that the patients are grinding their teeth at night. That gets into the medical risk factors, the medical history side of things that are important to know, parafunctional habits, clenching, grinding, all of that stuff that can increase the risk of damaging some of these things. Other things and techniques is like surgical placement of the implant, near anatomical factors or anything in the way like the sinus or the nose or how small the bone is, nerve damage, all of that stuff that has to go into this experienced surgeon, provider, dentist, specialist, tooth specialist, implant focused doc, whatever you want to call them.
Yeah.
All of that has to go into consideration of who you're choosing to do this with. So if we go back to the first thing we were talking about is these billboards, $9.99 or we'll do it all for $15,000. What are you getting? Are you getting a mixture of providers?
So it may cost more in the long run.
It may cost more, and you may have more problems.
Is it fair to say your hunch is it does cost more to do it that way?
Almost all of those cost more. And how much does that complication cost to fix?
Let's talk about technology. Okay. And correct me if I'm wrong. So I guess you'll know, like the Bible says, you'll know them by their fruit, the good fig trees have fruit growing from them. But so if they have intraoral scanners instead of the goop, a printer that prints some of the teeth, and even a mill that makes the final zirconia, this photogrammetry for precision implant placement, if they have those things, could you speak to that, how important that is in a provider and what that tells you about the provider?
Yes, so that's an office or a provider that's moving in the right direction or has already made that decision to move in the right direction. That's all newer technology and that's where they need to be. That's where that patient wants to go or needs to go to get this done right.
Full Arch Masters, you guys have that.
Full Arch Masters, that's exactly
what we have. You guys are all
have.
in with all the new technology?
And that's exactly what we teach. We teach Full Arch Masters with Ryan Dunlop. He gets all the latest and greatest materials, the latest and greatest printers, scanners. He tries them all out, tests them all out, beta testing, and then he tells everybody which ones worked. Well, here's the results. And then, so now you have all this information going out just to help the providers that are coming to learn all that stuff from Full Arch Masters. So an office that has that is moving in the right direction. They need to keep up on it. The old school technique, the goop in your mouth, not using photogrammetry. And photogrammetry, for those that don't know, it's a relatively newer technology in the medical dental world. It's been around for some time in engineering.
So what does it do? I mean, what does it mean to the patient, this photogrammetry?
Well, if I have to explain it, it's essentially a 3D spatial analysis or awareness of where the implants are. And those happen to be in the patient's mouth. So this scan 3D orientates where these implants are, so then you can very, very accurately line up the new teeth that go on there. And the old school techniques with the impressions and the goops and stuff, they line up close enough to get the job done, but they don't line up with precision.
So it's precision, it's gonna last longer.
It's
like
going to
a
last
lifetime.
longer because it reduces that stress. It's lined up perfectly.
Okay.
So now the teeth don't break. The implants don't lose bone because there's not weird stress on the implants with it not lined up straight.
Well, logically, this makes sense. Why isn't everybody doing it this way?
Well, it's new technology, and it's a
Okay.
lot of investment
Okay.
for these
Okay.
docs to do this. So again, if you have a provider, whichever specialty or general dentist are doing it, if they are not invested into doing this and they don't do it all the time, they probably don't have the latest and greatest technology to do it. And then you have to question, what are you paying for? And is this going to be done right? And what about complications?
I know what you guys are charging, by the way, and I know what the big guys are charging, and you're substantially less, probably 20% less. So, in a way, does it cost more to go to somebody that that has to outsource everything?
Yep.
Is there truth to that?
I think outsourcing, paying multiple providers, paying a specialist, paying a prosthodontist, paying a lab to make all this stuff could increase your cost. In addition to having to remake things multiple times, increase your costs. In addition to complications, again,
Okay.
the provider you choose in the office you go to is really important. That can increase the cost of the patient if things have to be done more and more, or they have to go somewhere else to have it fixed. Another increased cost. So experience, technology are two really important things.
Good. You know, I don't want to, when I invite you on the podcast, I don't want to scare people out of doing this, but I think it's important that people need to know some of these things. So if you had to summarize as a mentor, a key thought leader, a teacher, an instructor that teaches dentists, what are the top 4 mistakes you see that happen with inexperience? If you could just kind of roll through those.
Real quick, I'd say implant placement, inadequate bony remodeling that's needed on certain cases, not passive fit, which happens a lot more with old school techniques, not the new digital technique. And then I'd say adjusting bite and follow up on the patients. So
So the way the teeth come together play a major role in how long
the way
it's
the
going to last?
patient bites on it, yep, and the design of those teeth and where they connect and where they tap, where they touch. And then I'd say, if I added one more thing, is know your patient. I always say know your patient. The medical history
Okay.
and the medical risk factors of the patient are going to give you some advanced knowledge
Okay.
if you can expect some complications down the road. And that's a much better conversation to have with the patient ahead of time and discussing all these risks so we know what we're in for down the road. And we try to manage that or prevent as many complications as possible.
Do you think it's very telling when somebody is offering a lot of snap-in, snap-out dentures? Maybe they don't get it. And I know you don't want to say anything negative, but I know you're not a fan of these snap-ins. And I got to tell you the argument that I hear, they'll say, but Randy, not everybody can afford that full arch of teeth that don't come out, so we offer snap-ins as a courtesy to the patient. What's the truth about that in your opinion?
I think if you're doing a bunch of snap-in dentures, you probably don't have the experience in the full mouth fixed implant and tooth prosthetic in that world. Not to talk negative,
Why do you say that?
I just think that once you have the technology and the experience, the teeth that don't come out are light years better than a snap-in, snap-out denture. And with that technology, it's easier to make teeth that last a long time with less follow-up, and it's easier for the patient. They don't have to snap in, snap out, clean them, brush them, not wear them every night, go to the dentist,
Those
get
don't
new
last very
O-rings.
long?
They don't last very long. And
So does it cost more in the long run? You tell me.
It could. It could. What if you have a dog? If you set that thing on your nightstand or in a glass of
Is that
water,
right?
they love eating them. So there's all that stuff that goes into them, and the reality is it's still a denture.
So if a guy's doing a lot of snap-ins, they probably aren't serious about, as you guys call it, full arch.
I would expect they don't have any of the new digital technology that makes all of this much more predictable.
You say it's almost impossible to make a patient happy with those snap-ins because it's still a denture.
Still a denture. Still have to wear a denture. Still hurts. We're trying to give you a new smile and teeth that you can use, and we're trying to help your self-confidence, your self-esteem.
Do you think they use it as marketing? Like they'll show, hey, get new teeth with dental implants, and it's really just a snap-in denture?
I think that'd be.
Because I know that's going on here in California.
That'd be awfully, awfully misleading for somebody to market.
It's happening right now.
Full mouth implants and teeth, and it's a snap-in denture. So again, I mean, that goes back to saying the same thing.
But technically, it is a full, teeth.
It's a full set of teeth and implants. I would say again, question what you're getting when you see those ads, and think about or ask the hard questions. Does it all happen in-house? Do I see one doctor?
Okay.
What's the experience of that doctor? And who fixes the problems? And how much do those problems cost me? Those are important questions.
So I got a feeling you're not a fan of going an hour away from here to go to Mexico to get this done to save a couple $1,000s. Why is that a mistake, in your opinion?
So I don't like talking bad about docs at all. I'm a big advocate for everybody supporting each other. If a patient has a problem, the docs should work together in the community. That's part of being in health care in general. Take care of the patient, work together.
Okay.
So I think there's a lot of good doctors and providers in Mexico or in other countries and stuff like that. But the question is how do you know? What I would ask the same questions. Hopefully there's not a language barrier. Hopefully everybody speaks the language of the same language as the provider. That'd be ideal. But how do you know who's a good doc and who's not a good doc?
Have you found that they cut some corners?
I think
on
cutting
materials
corners on costs or expenses of the office, stuff like that. I think that, I'm assuming, and it's only the patients that I see that have complications that come back because they probably have thousands of successful cases out there.
Okay.
But I see the patients that come to me with complications from having implants elsewhere.
And they have no recourse. I guess you can't sue a guy over there.
And there's no going back. And they don't get it done. And they don't get it fixed. Again, that question of who fixes the complications and how much does it cost? Well, now they're coming to me and I fix the complications and they have to pay for it. So choosing the right place the first time. Excuse me, not to say that they don't have good providers down there. I only see the ones that come back with problems, and I don't know if it's less antibiotics, less infection control, a different technique. Maybe they drill with no water. Maybe they put them in too tight. I don't know. I'm not there. I haven't seen it, but I see the problems.
Okay.
And when those problems arise, I try to say, well, it didn't save you money to do that because now we have to fix it.
There's a quote from Warren Buffett, and it says, to minimize risk, you got to find somebody that knows the rules of the game. And so there's rules of the game when it comes to implant dentistry. And do you agree with that?
I completely agree. There's a technique for doing it that has evolved over the 60 years we've been doing these. And that technique's evolved to have lower and lower complications. And by complications, I mean broken teeth, bone loss. We use the word failed implant, but very rarely does the implant itself actually fail by flouring the implant or cracking or breaking the implant. It's normally the remodeling structure around the implant is the bone.
Implants get loose?
Implants get loose.
Because of the wrong placement or the wrong implant, things like that?
Exactly, and because the bone is remodeling away from the implant, or there's an infection around it which turns it into soft tissue. So it's not necessarily the implants fail, the body's response to whatever is causing this complication.
So in summary here, would you say that by finding somebody that has all the technology in-house, has the experience, they do this every single day or every week, that it's pretty much less than doing it the other way?
I think it has the potential to cost less, be easier on the patient, less risk of complication, and a better outcome.
Okay, good. I want to thank you for coming on the podcast. Good stuff. And you still see patients on the consults?
Oh, yes.
Or do you have somebody else that does a consult?
I see them myself.
All right.
It's really nice. I like being able to create that connection with them. When we go into something like this, I like everybody to feel like family. They have to trust me. They have to know that I'm going to do the best job I can, and I'm there to take care of any problems that they have. So.
Okay, good. Thanks.
Well, thank you very much for having me.